Hi, I'm Junae Staples and I'm a physical therapist at Shelter and Arms Institute. So today we're going to talk about the piriformis muscle, which seems to be a hot topic and everybody's looking up right now. It's actually one of your deeper glute muscles. So normally if a patient comes in with sciatica, sometimes it could be due to the piriformis muscle just being really tight. So there are some different stretches that we can go over today depending on, again, how tight the patient is or what position is optimal for them. So starting off, if the patient can get into a laying down position, I'll start with them laying. And if they are able to, I'll have them cross their leg like this. If they're already tight and they feel it in this position, this could be something that could go home with them as a home exercise program. If not, either they can bring their knee up towards them or going down the opposite way. But the most optimal way to get the piriformis is actually having them loop into like a figure four position, which really gets at that muscle. So in the seated position, which you can do, if they are, again, able to cross their legs, I'll have them do that. And sometimes they already feel it in that area. If they don't feel it, again, you can kind of have them push down on their knee or have them kind of hug their knee up if they can. If they're really tight and they can't kind of have their hands wrapped around their ankle or either at their knee, I'll have them kind of get a towel and wrap it around and have them kind of slide it towards them. If none of those work, then the other option that I'd have them do is I'll have them get a tennis ball and basically have the tennis ball against the wall, have the ball here in their hand, and kind of find that area in their hip that's really tight and tender, and I'll have them kind of roll it out against the wall. Or if they're going someplace where they're going to travel for a long time, either by car or by plane, and they can't really get up, sometimes they can either sit on the tennis ball, roll their hips for maybe a minute or two, and then they can do it that way.